Hello, I'm Nurse Jesus. What brought you guys into the clinic today?
Well, I'm really looking for a new birth control. I was on the birth control pills, but as you can see, it didn't work out quite so well. So I want something that I don't have to remember to take every day, something a little long-term.
Sure, and we have a great option for that. Would you be interested in an IUD, also known as an intrauterine device?
Well, I don't quite know what it is. Can you explain that to me?
I would be more than happy to. So, an intrauterine device is inserted through the vagina up into the uterus, where it takes place and begins to start to release hormones. These hormones then function by thinning the uterine lining, which prevents any eggs from implanting and beginning the whole process. It also works to create a hostile environment, so any sperm that gets up in there will die from the pH level that's going on. And it also works to create thicker cervical mucus to prevent any sperm from getting up into the uterus.
Nice. It sounds really good, but does it have any side effects?
There are a couple of side effects if you do go this route. One of them would be heavier bleeding and worse cramps when you have your menstrual cycle. And there is an increased chance of getting ovarian cysts. That is some side effects. However, there are plenty of advantages to an IUD. One of those being that it is a long-active reversible contraception. And as you see, we have two options. You have a hormonal or a copper, each lasting either from 35 years to 10 years. And again, it can be easily removed. So you would just go about scheduling an appointment with your provider, and then they would conduct a process to easily remove the IUD from the uterus, the same way that they put it in. And it is still safe for breastfeeding as well, since you have a newborn here.
That's awesome.
Yes, and it's proven to be at least 99% effective.
That's just what we need.
Or could we still have just simple sex? Am I going to be able to feel it? Is there going to be any issues with that? Or
No, it shouldn't interfere at all with any sort of sexual activity that you'll have. Again, they're cut pretty short up in there, so you won't have to worry about them getting in the way of anything. But, you know, STDs and whatnot are still transferable, so just still practice safe sex, of course. And with that, there is still an increased risk for pelvic inflammatory disease. There is a risk for a uterine perforation or an ectopic pregnancy. So those are some other things to be aware of.
Okay, so is there anything I need to do after I get the procedure?
Yes, after you get the procedure, you may be feeling some slight discomfort. You'll have some cramping, maybe some irregular bleeding going on. So we do recommend that you take Tylenol for that pain, and continue to use your prior birth control for about 2 weeks. Is a good option for that. And we also do recommend that you check the threads to see that they are still there and that you haven't lost track of it or anything of that sort.
Yeah, sounds good. I think I'll go ahead and schedule an appointment with my provider.
You should totally do that.
Do you want to be like me? If not, consider an IUD.